Today, let's learn something about Chapter 15 Neurodegenerative Diseases. In the first part, we are going to talk about Alzheimer's disease. Alzheimer's disease is a form of dementia that is eventually fatal. Over time, a person's brain undergoes irreversible, progressive degeneration that impairs his or her memory and reasoning. In the late onset form of Alzheimer's, patients display symptoms in their mid-60s or later, with symptoms becoming more severe with age. In early onset forms of the disease, patients can start to experience symptoms in their 30s. Fortunately, early onset Alzheimer's occurs in less than 10% of cases of the disease. Alzheimer's symptoms are classified by the disease's progression. Early-stage symptoms include memory problems, difficulty concentrating or finding appropriate words, problems judging and calculating, and disorientation in time or place. Most people are not diagnosed until the mid-stage, when symptoms include personality and behavioral changes, wandering and getting lost, repeating questions, losing and placing objects in odd places, taking longer to complete daily tasks, and having trouble handling memory and paying bills. In the moderate stage, some patients have trouble recognizing family and friends, inability to learn new things, problems coping with new situations, difficulty getting dressed or performing other multi-step tasks, and delusion and paranoia, and impulsive behavioral. In the severe stage, patients are completely dependent on others for care. As their body begins shutting down, their communication is reduced to organs, moans, or grunts. Sleeping increases, and they become bedridden. Other severe stage symptoms include weight loss, seizures, difficulty swallowing, skin infections, and a lack of bowel and bowel control. So it's know the diagnosing diagnosing Alzheimer's. Alzheimer's dementia is most commonly diagnosed by physician asking the patient and family member or friend about the patient's health, medical history, ability to perform daily activities, and changes in behavioral and personality. Next, the physician conducts tests on memory, problem solving, attention, counting, and language. Even if mental deficits are found, including dementia, the condition still might not be Alzheimer's. Similar deficits could be due to other conditions, including Lewy body diseases, frontotemporal dementia, Parkinson's disease, stroke, a tumor, sleep disturbance, side effects from medication or infection. Researchers are searching for a defining biomarker for Alzheimer's, a specific indicator that can physically identify a disease. Two candidate primary biomarkers are amyloid beta and 2. In Alzheimer's, amyloid beta forms extracellular senile plaques, also known as neuritic plaques. These malformed clumps contain a fragment of the preliminary protein. In addition to a, a type of protein that normally stabilizes the cellular skeleton, forms neurofibrillary tangles inside neurons. Both Both abnormalities are found in the brains of people with Alzheimer's, but at present, no definitive biomarkers can diagnose the diseases in its early stages. A diagnosis can only be confirmed by postmortem examination. Some potential diagnostic methods for Alzheimer's include brain imaging, genetic risk profiling, and examining cerebral spinal fluid or blood. Neuroimaging among the most promising areas of research focused on early dictation, using a mildly radioactive chemical marker that binds to amyloid plaques and shows their location in PET scans of living people. Starting in 2012, the FDA began approving the use of molecular imaging tracers to evaluate possible Alzheimer's diseases or other causes of dementia. To date, the FDA has approved the use of three tracers. And however, neurotrichic plaques are also present in the brains of people with no dementia or Alzheimer's, so these scans are not used for routine elevation. And the treatment of Alzheimer's. The FDA has now approved 5 prescription drugs for treating Alzheimer's. While they relieve some symptoms, they do not cure or halt the disease. 3 of these drugs are cholinesterase inhibitors, donepezil, galantamine, and rivastigmine. Cholinesterase inhibitors stop the action of acetylcholinesterase, an enzyme that breaks down the neurotransmitter acetylcholine. This increases the available amount of acetylcholine, which counteracts the damaging effect of the disease on production of this neurotransmitter. The first drug, memantine, is an NMDA receptor antagonist. Normally, NMDA receptors bind the neurotransmitter glutamate, allowing calcium to enter the neuron. In Alzheimer's, the damaged cells become overwhelmed with calcium, further damaging the neurons, a condition called neuronal excitotoxicity. Memantine blocks the flow of calcium through NMDA receptor channels. The fifth approved medication combines donepezil in memantine. Donepezil can be used in all stages of disease. Galantamine for mild to moderate stages, memantine for moderate to severe stages, and rivastigmine in all stages. The donepezil cocktail is used to treat moderate to severe Alzheimer's. Several clinical trials are now underway to find new and better treatment for Alzheimer's. The Alzheimer's Forum currently lists 14 treatments that are in the later stages of clinical trials. Overall, however, there is a high failure rate for drugs on the road to approval. Between 2002 and 2012, just 0.4% of Alzheimer's drugs were approved. Potential drugs have often proved ineffectual because they don't target Alzheimer's early pathology. Online registers may improve the situation by hesitating participants' recruitment for clinical trials and looking for people at ever earlier stages of disease progression. Trials are also broadened the pool of participants to include people likely to develop Alzheimer's but currently asymptomatic, as well as other participants at the pre-dementia stage. Another treatment strategy based on the amyloid hypothesis uses the body's immune response to attack and clear amyloid plaques. Trials for active immunization and passive immunization have both been explored. So far, however, these types of therapies have been inadequate for people with moderate to severe symptoms. And Alzheimer's disease is associated with high levels of beta amyloid protein, and this protein comes together and forms plaques, which are pictured in brown. And these plaques can build up between neurons and interrupt their activities. Two proteins also accumulate and form tangles, seen in blue, within neurons, disrupting communications. And the next part we are going to talking about is about Parkinson's disease. Parkinson's disease is the second most common neurodegenerative disorder in humans. Like Alzheimer's, its incidence increases with age, with the average onset around age 60. At first, Parkinson's characterized by motor problems, slow movements, muscular rigidity, poor coordination and instability, and shaking in hands, arms, legs, jaw, and face while at rest. As the disease progresses, the shaking, known as resting tremor, may worsen and interfere with walking, talking, and other simple tasks. Cognitive decline often occurs at later stages. Some people develop depression and other emotional changes, difficulty swallowing and chewing, skin problems, constipation, or urinary problems and sleeping problems. However, the rate and intensity of Parkinson's progression vary. Some people become severely disabled, while others have only minor motor disruptions. Parkinson's is a motor system disorder caused by the loss of dopamine-producing cells, neurons, in the substantia nigra, a midbrain structure that is considered part of the basal ganglia. This brain region affects movement, reward, and addiction. At the cellular level, the death of neurons likely arises as a result of damage to mitochondrial respiration. Some early onset causes are linked to mutations in the PARK2 gene, which codes for the protein parkin. Most types of Parkinson's are caused by a combination of genetics and environment, but an estimated 15 to 25% of people with adult onset Parkinson's have a known relative with the disease. Genes like SNCA repeat SNCA, LRRK2, and GBA also point to the importance of genetics as a causal factor. And the treatments of Parkinson's disease include levodopa temporarily relieves Parkinson's motor system symptoms but does not slow disease progression. A surgical procedure called deep brain stimulation is increasingly used to treat Parkinson's patients whose symptoms, including rigidity, tremor, slowed movement, and mobility problems, do not respond adequately to medication. The DBS technique implants a small neurotransmitter device, like a pacemaker, that send electrical impulses that interfere with the waves and block brain signals that cause the motor symptoms of Parkinson's. And the next part is about amyotrophic lateral sclerosis, and it's also called ALS. ALS is a group of progressive, ultimately fatal motor neuron diseases. ALS is also called Lou Gehrig's disease after the renowned New York Yankees first baseman, who was one of the most famous victims of the disease. ALS first forced Gehrig to retire at age 36. And motor neurons connect the brain to the spinal cord and to the voluntary muscles throughout the body. In ALS, the motor neurons degenerate and then die. Without this neural communication, a person's voluntary muscles weaken, begin twitching, and finally atrophy. Only only 5 to 10% of ALS cases are due solely due to genetic factors, a condition called family ALS. The non-familial disease is called sporadic ALS. While several genes have been identified that increase susceptibility to ALS, there is no clear pattern of inheritance. Among cases with a genetic component, about 25 to 40% are caused by a harmful mutation in the C9orf72 gene. Some individuals with this mutation show symptoms of both motor neuron and dementia disorders, a condition known as ALS-FTD. Another 12 to 20% of hereditary cases result from mutations that prevent the SOD1 gene from coding for superoxide dismutase, an enzyme that catalyzes the breakdown of cell-damaging sporadic radicals into more benign molecular oxygen and hydrogen peroxide. This and other hereditary forms of ALS, such as those involving UBQLN2 and VEGF genes, provide valuable insights into the mechanisms of the disease. And there is no cure of ALS, nor has any medication been found that can stop or reverse its progression. But the FDA has approved Endeavor and Resolve for treating ALS. Endeavorin, an antioxidant that inhibits the production of cell-damaging free radicals, can ameliorate disease symptoms. Resilio decreases glutamate levels and has been shown clinically to extend the life of ALS patients by a few months. And that's all about just this chapter.